Welcome back, everybody. Mental health on college campuses, an important conversation to have. Yeah, especially when colleges, parents, and students can find themselves, well, unprepared to deal with some really critical situations.
Sure, and here to help from Continuum of Care are John Lebetic, Acute and Forensic Services, along with Gretchen Richardson, who works in program development and clinical care. Thank you both so much for being here. John, let's start with you. Give us an overview of Continuum of Care before we really dive into this.
We're a nonprofit agency. We've been around for over 50 years, working with mental health, residential, and clinical services.
And at college years, sometimes these mental illnesses develop and people might not be prepared.
Right. So those first few years of college, ages 18 to 24, is when we do see young adults with emerging psychosis, first break psychosis, which I think we've talked about on this show before. And aside from alcohol, marijuana, stimulants, and ecstasy statistically are the most common abused drugs on college campuses, which can,
make a situation worse, right?
Yes, using those substances, depending on the potency and the individual, they can mimic psychotic symptoms. So it gets complicated, and it's important to have a good assessment and somebody that's trained and credentialed in making that assessment for folks. What I think we don't talk about enough of is that, when young people are experimenting with drugs and it turns to abuse and dependence, more often than not, there's always an underlying mental health issue that's not being treated. Depression, anxiety, trauma, OCD. Those are the, underlying themes that we try to look at.
Maybe we can talk a little bit about parents, because I imagine it's a tricky time for parents. If, their son or daughter is off at school, there's maybe a disconnect and they get a little bit more freedom, and maybe that's a challenge for the parent to understand where and how deep they should go when it comes to maybe trying to get some help or have a conversation. What do you guys think about that?
Absolutely. I think that with the statistics being that 80% of college students could be diagnosed with an anxiety disorder. Another 44% could be diagnosed with a depressive disorder. And in addition to that, suicide is actually the third leading cause of death in college-age students. So it's really important for parents to look for things that seem off. Their child has become an adult, and that changes things, because that adult can now make decisions on their own. That adult can now refuse treatment. That adult can now refuse medication. And so anything that you notice with your child, it's really important to have that addressed and to be looked at in a way that can be taken care of, whether it be on a college campus or off-site of the campus. We actually have a recent partnership with a college where in the first week of school we had 7 referrals.
Wow.
Which shows the need right here in our own community of how many people are just struggling at that change in life.
When you get that referral, what is the first step? How can you help these families?
So the first step is generally to look at the individual as an individual first, right? So to take their needs, what's happening to them on the college campus, what's changed for them, and to really look at doing a very clean assessment. So everything from the mental health piece to the substance abuse piece to looking at what the social needs are.
Excellent. Well, for folks who are out there watching, maybe want some more information about what it is that you guys do and the help that you provide, how can they find out more?
Our website, continuumct.org, and we do have the crisis residential treatment program that I've talked about before, which is a great resource for families that have young adults that need a safe place to go in that formal assessment and diagnosis, and that continuumct.org. You can find all that information out there.
And mark your calendars, because you guys are having a special event Saturday, December 7th.
We are. It's our holiday bazaar, and we have tons of artisans and actually even clients of ours who live in our residential services who will be making and selling products for just in time for the holidays. So come on over and do your holiday shopping.
We love it. Thank you both so much for being here and for what you do. And learn more over at continuumrecoveryservices.org.